It's time now for Follow the Lead, a deep dive into the stories making headlines and moving markets. All this week, we're focusing on different areas of the U.S. job market, and today we're looking at the healthcare sector. And to get us started, we turn now to Michael McKee, Bloomberg International Economics and Policy Correspondent. Michael.
David, nothing more appropriate than talking about healthcare when you're talking about jobs, because it is the one sector of the economy where job growth has just continued no matter what. Take a look at hiring here. The white line is private sector jobs, and the blue line is healthcare hiring. Look what happened in the recession. Of course, we lost millions of jobs. But what happened to healthcare? Just kept going throughout the recession as more and more people get hired. We need more people because society is aging, and so we need more medical care and we need more home health care. And you can see what happens here. The jobs of the future are in the services category here, where people go into people's homes and help out. You can see the white line there. Services for the elderly, rapidly growing. Medical lab technicians, though, falling off. And I know you're going to get into this idea of telemedicine and things like that. Those jobs can be moved overseas, but we need people in homes. So home health care is a rapidly expanding field. But the bad news about that is, if you want that job, you're not going to get paid very much. Look at the pay rates in healthcare, nowhere near what they are in other industries, particularly like manufacturing. This is doctors' offices, people with some skills. They're making about $16, almost $17 an hour. But you go to medical lab technicians, their pay has fallen off as jobs have moved overseas, $10.75. And those rapidly growing home healthcare aides, they're only making the minimum wage. It's not a job that you want if you have a lot of skills, and that's making it harder and harder to find people, but at the same time, it's not pushing up wages. So healthcare, a dynamic area, but one that has some questions ahead.